All right, we're ready to go here. I'd like to introduce our President and CEO, Loretta Bush.
Thank you, Dennis. And thank you, everyone. Good afternoon. As Dennis said, I'm Loretta Bush. I'm the President and CEO for Authority Health. And it is my pleasure to welcome you here today to what has been our annual celebration, and how thankful we are that we're able to do it this year live and in person. This luncheon is a way of us expressing our gratitude to all of our partners who have helped us accomplish our mission over the many years. Now, it's our tradition here at Authority Health to start every meeting with a reflection. And so for that, I'm going to call up Mr. Dennis Archambault.
And we are maintaining our protocol. Thank you. As we celebrate the holiday season, this reflection offers thoughtful words on the passing of the year and an opportunity to stop for a few moments and reflect. Ditch the resolutions. To resolve means to find a solution to a problem. You are not the problem. The way you showed up for your life in the past year was necessary for your growth. Now is a time for reflection, to learn about yourself, to learn about the world around you, to create an intention, a positive call to shift, a spark of magic and manifestation rooted in self-love and backed by action. Make the most of this moment.
Thank you, Dennis. Beautiful, and it always sets the intention when we open with a reflection to get us started. Next, I'd like to introduce to you our Chairman of the Board, Wayne County Commissioner Tim Killeen. Come up and bring us greetings.
Well, I'm going to repeat here something I heard in a meeting with Curtis Sertel a number of years ago. We sit down in a meeting, small group, they hand out paperwork, everybody reaches for their reading glasses. And Curtis says, it's not that my eyes are getting worse, there's just less light in the world. So, good afternoon, everybody. Good afternoon. It's great to do this in person again, but still be careful of the masking and all of that. I have served on the board of directors of Authority Health for much of its history. Recently, I've begun to see this organization begin to really achieve its potential and build on the hard work of so many years in the making. As a representative of the community on this board, serving as chair, I am confident that the community is getting great value. We're seeing real numbers in the physicians we are training to work in underserved areas. Our health centers are expanding access to people who may not be connected to a neighborhood primary care facility, and a good one at that. And we have been expanding, getting into the neighborhoods. That's our job. Authority Health is not just a provider of necessary services. It does so with quality in mind, and that's why you guys are here today. Under the leadership of Loretta Bush, Authority Health is building the future with thoughtful consideration of mission and attention to financial responsibility. That's the worst, to build something and then the finances don't work. You got to have that in place right from the start. And I see all these nonprofit people out here going, yeah, heck yeah, you do. Detroit, Wayne County, and the state of Michigan can be thankful that it established this organization and its potential for serving the people in the years ahead. On behalf of the Board of Directors, thank you to our partners, especially the best of the Safety Net awardees today. Thank you so much to our staff, especially our Employee of the Year, which is coming later. So thank you all for being here today, and happy holidays to all.
Thank you, Commissioner Killeen. Thank you for your opening remarks. But most importantly, thank you for how you have led the board over the years. You've done that with commitment, with distinction, and with honor. So we know that you really appreciate the work of Authority Health, and you show it by giving us your time. At this point, I'd also like to acknowledge our board of directors, and I'll say this first. You know, sometimes life happens and other commitments happen, but we do have one of our other board members here, and that's Denise Brooks Williams. And Jess, if she could wave and you could acknowledge her. All right, and then before I get started with my formal remarks, let me do this. You know, any public speaker loves to have an audience, and there's a lot of empty seats right here because it says reserved. So feel free, if you are standing or if you're way back there, please come up and have a seat. I see NZ moving, I see some others moving this way. Please come on up and take a seat. And as Commissioner Killeen said, there's less light in the world, so I'm going to put on some glasses. It's amazing how that happens. All right, let's get started. So the work that we do to strengthen the healthcare safety net is far greater than any one person or any one group of organizations. The work is often complex, it requires a sustained effort, and it needs collaboration to bring about the best possible outcomes for the people that we serve. So today is that time that we formally honor a few colleagues in our communities who have demonstrated extraordinary contributions to the healthcare safety net through their individual efforts, but also through the work of their organizations. We will announce the best of the HealthNet Award winners at the close of my remarks. I think that we all can agree that we need to stop and celebrate the privilege of health that allows us to be together here today. What a ride it has been. I think we'd all agree. It has been a ride. We all have had personal as well as professional experience with the struggles that the pandemic has brought. And while those struggles continue, we continue as a community and as a society to not only survive, but to also thrive and to do the work necessary to make this a better community. Authority Health is pleased to announce that we had a strong year in 2022. It was built on a foundation of good fiscal management and strategic development. Our clinical operations are seeing increased patient visits, improved outcomes, and the potential for expanding services. I am very fortunate that I can say that my staff is highly skilled, they are resilient, and they are dedicated to the mission of Authority Health. And our board of directors, as well as our advisory boards, are committed to providing the best possible guidance and to support the advancement of our mission. Now, many of you have been friends, supporters, and collaborators with Authority Health since our inception. You have journeyed with us for over 17 years as we fulfilled our role as a convener, a fiduciary, a leader in community-based medical education, and a provider of health and human services. Our foundation is built on a few key areas: Medicaid enrollment and navigation, clinical services, the medical residency program, our fellowship programs, and community service. The year 2022 allowed us to emerge from the initial years of the COVID pandemic, to examine our strategic direction. We started the year with a full staff retreat and ended it with a strategic session with our leadership team. We believe that this is the moment that Authority Health will evolve to provide even greater impact on the health of our communities. I'd like to highlight just a few activities. I'll start with services. Authority Health has established a presence in 3 community health centers. It includes the Popoff Family Health Center on Detroit East Side, the Anne Murray Ice Pediatric Health Center in Southfield, right on the edge of Northwest Detroit. And I always like to say when I'm mentioning that clinic that it's right there where it converges, where you don't know if you're in Oak Park, Southfield, Detroit. You're not quite sure where you are. But our patients find us, and the majority of our patients that go there are Detroiters. And then we have our Hope Family Health Center, which is located in Narton Park on the near west side of Detroit. In 2022, these health centers have become more financially viable, and if you operate outpatient health centers, you know it's a pleasure to be able to say that they have become more financially viable, and this is through improved business processes. But also, we've noticed that there is more than a 35% increase in the patient volume in our health centers compared to last year. Some of the factors that have impacted the growth include the addition of community health workers, our efforts to reduce patient no-show, and again, if you operate clinics, the efforts to reduce patient no-show is critical, and our community engagement, which promotes awareness of our services, including our efforts to reduce vaccine hesitancy around COVID, as well as the other vaccine-preventable diseases. Now, through a funding allocation from the state of Michigan, we were able to add 3 community health workers to our staff, 1 for each of our community health centers. As many of you know, community health workers are valuable connectors in our community. Our CHWs are assisting our patients with care coordination for chronic disease management, providing health education, and partnering with our patients to navigate the social determinants that can either support or hinder health and wellness. Additionally, the Blue Cross Blue Shield Foundation has funded a peer counselor for our medication-assisted treatment program at the Popoff Family Health Center. The peer counselor provides credible engagement with the clients through their lived experience, as well as supporting them in connecting the physical and mental health pieces that will help them on their road to recovery. Our medication-assisted treatment program has grown substantially, in large part due to our partnerships with the 36 district specialty courts. These courts include the Drug Court, the Veterans Court, and the Mental Health Court, along with the addition of Dr. Hassan Shagir, who is board certified in addiction medicine. Our program also conducts substance use disorder support groups, as well as individualized counseling sessions. But at the heart of it all is effective teamwork and treating our patients in a professional and welcoming manner. Please join me in applauding our clinical staff. Now, our professional workforce development is one of the additional pillars here at Authority Health, and we have built upon that throughout the years. We began with our administrative internships and fellowships. Then we moved into our graduate medical education teaching health center program, which I always like to remind people is the second largest in the nation. We're very proud of that. And this program is not only providing unique community-based primary care training, but also we are training our residents in population health, trauma-informed care, as well as the impact of racism and social justice on health and well-being. These are the physicians that I know we truly want to be serving all of you and your children and your grandchildren in the future. Our educational series on racism and healthcare was developed in partnership with New Detroit, and it resulted from our residents' desire to learn more about how racism impacts their work. This year, we launched a new program, Just Care, Health Equity, which delves deeper into social justice in healthcare. We were honored this year to have Michigan's Lieutenant Governor, Garland Gilchrist, speak at our commencement activity for our residents. This year, we graduated 24 residents in 4 disciplines: family medicine, internal medicine, psychiatry, and pediatrics. Since the beginning of our program, we have a total of 149 graduates since our program began. Since the inception of the program, nearly 50% of our graduates remained in Michigan, which is a goal of the teaching health centers, and 79% are practicing in medically underserved areas. Now, Authority Health not only wants to prepare physicians in knowledge and skills that will make them a better community physicians, but we want them also to know how they can have an impact on our communities. To that end, we are enhancing our community medicine program, which places medical residents in community settings to provide medical education as well as services. Authority Health has established an additional partnership with the Detroit Public School District and Kids Health Connection to develop a school-based health center in Southwest Detroit. Our community medicine physicians will provide medical coverage in person as well as telehealth when needed. Additionally, we established an advocacy rotation, which trains residents in various ways that they can advocate on behalf of their patients, and also to advocate on behalf of community health as well as their profession. 2 of our residents completed this month-long training this year. We are also proud that one of our residents, Dr. Nicholas Fletcher, was awarded a 2-year fellowship in public and community psychiatry from the American Psychiatric Association. Dr. Fletcher's award reflects the character and the professional interests of our physicians in community-based medicine for underserved populations. Please join me in applauding our graduate medical education staff. Another important contribution of our education efforts is our Albert Schweitzer Fellowship Program, which prepares humanitarians of the future in public health, medicine, nursing, social work, and other academic disciplines. To date, we have graduated over 20 Fellows for Life who are pursuing their work in Detroit and beyond. We look forward to graduating our 6th cohort this spring. The fellowship not only provides excellent training for these young professionals, but it also provides sustainable community services to support the health safety net. 70% of our fellowship projects are sustainable after 1 year. One of them is a vaccine hesitancy project that demonstrated how cultural humility and sensitive conversation with patients can lead to acceptance of the COVID vaccine. Our commitment to education doesn't stop with the professional workforce. We're also looking for ways to educate our patients and to inform the public about prevention and disease management. This will help to keep our communities, our neighborhoods, and our families healthy at all levels. To that end, we are very privileged to receive a major grant from the Total Healthcare Foundation, and I believe it is still the largest single grant in the foundation's history, to fund the expansion of the Popoff Family Health Center. This will include a community kitchen, meeting space, and additional behavioral health space. One of the hallmarks of community health is nutrition. We have been long-term supporters of the Fresh RX program in partnership with Genesis Hope. We want to help our patients as well as the community to understand that nutritious foods can taste good and be culturally satisfying. That's a fancy way of saying if it's not good, we're not going to eat it, right? We plan to host the community nutrition education programs at the kitchen and in the conference space. One of the determinants of health certainly includes food insecurity and malnutrition. Community health professionals have known for a long time that the issue of food insecurity is complex. It requires a better distribution of quality food, as well as the knowledge and skill of how to prepare it. So now, with the financial support of the Total Health Foundation, Authority Health will provide ongoing nutrition education on the east side of Detroit. Please join me in applauding and thanking the Total Health Care Foundation for their generous contribution. Now, community engagement is one of the ways that Authority Health has built a strong foundation. And it began with our convening activities, which include our regional motion coalition on prevention and childhood obesity. And I think I saw some of our partners here from the motion coalition. If you're still here, can you raise your hand? They may be in the, still, okay. All right, we welcome you here, all right. And as well as we serve as fiduciary and administrative support to the Wayne County Catalyst Grant, and I see we have one of our partners here from the Wayne County Catalyst Grant, and that grant serves to promote health literacy and work to overcome COVID vaccine hesitancy in our county. We're working with community health centers and nonprofit organizations to improve the vaccination rate in the county. We're proud to have the opportunity to also support such initiatives as Healthy Dearborn, the Environmental Health Research Academy, and the Senior Housing Preservation that happens in Detroit. We also advocate for state funding for health and human service programs that positively influence community health. We work with our community partners in identifying ways to support environmental health advocacy through social media and public testimony. We also support the initiatives of the Motion Coalition on Childhood Obesity. This coalition is convened by Authority Health. This regional coalition of individuals and organizations promotes public policy that supports healthy eating and active living. This year, we have supported a few things. I'll name 3 of them. We've supported licensure for dietitians and nutritionists. Through this, it will provide a framework for registered dietitians and nutritionists to provide medical nutrition therapy to our patients. Then also we supported SNAP eligibility for college students, which would increase food access to the growing number of food insecure college students. And I don't know about you, I hadn't really thought to think about that until the Motion Coalition brought that to our attention. So to be able to provide SNAP benefits to food insecure college students is major. And then the Corner Store Initiative, which extends the eligibility of neighborhood and commercial corridor food initiatives under the Michigan Community Revitalization Program. Now, our Medicaid and health insurance counseling services, they have been very robust over the years, but we needed to withdraw a bit from our engagement during the initial years of the COVID pandemic. I think many of us can say, COVID kind of messed up everything. So, however, we were able to get back out into the community, and this past year we have participated in several community-level events this summer and the fall. Now, last but not least, let me just say one word about finances, and that is, I am pleased to report that Authority Health completed the year in a strong fiscal position, and we anticipate yet another clean audit. I am truly excited about the possibilities of 2023. Our leadership team is in the process of planning a new phase in our development. We are kind of referring to it as building on a strong foundation. So more to come on that. Authority Health is fulfilling its mission dating back to 2004. And we are committed to supporting a healthy, resilient community for the future. Now, this concludes my formal remarks, and I thank you for your attention, but most importantly, for your support over the last 17 years.